Hello, I'm Stephanie Williams with the COPD Foundation, and today we are here to talk about COVID-19 vaccines. I am joined by Dr. Sallyann Coleman King, an Emory University trained physician with a master's in public health from the University College London. As part of the CDC COVID-19 emergency response, Dr. Coleman King serves as the sub-team lead for those with high-risk medical conditions on the disproportionately affected adult populations team and on the vaccine implementation unit of the Vaccine Task Force. Welcome, and thank you so much for being with us today.
Thank you for having me. I'm delighted to be here today, and I am delighted to talk to you about COPD and COVID-19 vaccination.
Well, thank you. And I know our community is eager to hear from you too and learn all they can about COVID-19 vaccines. So without any further delay, I would love to turn this presentation over to you.
Fantastic. We will get started. All right, I see the slides. Yep.
Here we go.
Perfect. And again, yes, my name is Sallyann Coleman King, and I am happy to be here today. Next slide, please. So today I'm going to start by reviewing some of the basics of COVID-19, many of which you probably already know. Then just to make sure we're all on the same page, we're going to discuss chronic obstructive pulmonary disease, or COPD, and then of course COVID-19 vaccination. I'll give you some information about the COVID-19 vaccines, and then we'll discuss getting vaccinated, and we'll send you back into the world with some information about how you can support your community. Next slide, please. So over the last year, we've all seen that infections with SARS-CoV-2, this is the virus that causes COVID-19, can result in a large range of illnesses, from mild symptoms to severe illness and death. And what's particularly tricky is that about 30% of people infected with SARS-CoV-2 don't have symptoms at all. And we can't really predict how severe a person's illness may be, but there are certain factors that can increase your risk for becoming severely ill when infected. One example is older adults. So as you age, your risk for severe disease from COVID-19 increases. Likewise, if people have certain medical conditions, including COPD, and we'll talk about this a little bit more, you're also at higher risk for developing severe disease if you get COVID-19. But first, let's talk a little bit more about COPD. Next slide, please. So as all of you know, chronic obstructive pulmonary disease, or COPD, is a group of diseases that cause airflow blockage and breathing-related problems. This typically includes emphysema and chronic bronchitis. Almost 16 million Americans have been diagnosed with COPD, and a lot more haven't been diagnosed yet. And when we think about those who are more likely to have it, it's often women, those over the age of 65 years of age, American Indians and Alaska Natives, chronic, current or former smokers, and those with a history of asthma. You'll see on the right, this is a model where they've tried to look at the number of those diagnosed with COPD by census tract, or the small area. And we don't have the data to produce the exact estimates, but you'll see that when they use math to predict the estimates, there's a lot of variability across the country. You'll see the prevalence of COPD varies a lot between different states, and the highest prevalence often clusters, especially around the Ohio and lower Mississippi rivers. Next slide, please. Great. So when we think about COVID-19 and we try to understand which medical conditions impact someone's risk for severe disease, CDC worked to create a list of conditions that have been shown to be associated with more severe COVID-19. And when I talk about those at highest risk for severe disease, what I mean here is we define that as being at higher risk for being hospitalized, being at higher risk for needing mechanical ventilation to breathe, or death. You'll see here on the list that COPD is one of the moderate to severe lung diseases that is listed, including moderate to severe asthma and interstitial lung disease and COPD. That makes many of you at higher risk, or those that you love or care for or help to support. It's important that you also remember that this is not a list of every medical condition. This is just the ones that we have the most data on. So there are other medical conditions that are also similarly increasing people's risk. The other thing to keep in mind is that if you have more than one medical condition on this list, it also increases your risk even more. The list was just updated on March 29th, and it's going to continue to evolve as we learn more. But keep in mind, that your risk may shift, and that may impact how you protect yourself. Next slide, please. So while we're talking about risk level, there are a couple of additional things that dramatically increase your risk. The first one is race and ethnicity. Race and ethnicity are, of course, markers for underlying social conditions that impact health, like socioeconomic status or access to health care, and exposure to occupations or work sites that can likely increase your exposure to the virus. But it's important to keep in mind that if you look at this chart, you'll see that if you're an American Indian or Alaska Native, you'll see here right there in the first column that you have almost 4 times the risk of hospitalization from COVID-19 compared to someone who is a non-Hispanic white. Next slide, please. Another really important risk factor to keep in mind is age. As you look at this table and look across the bands, you'll see that each age group is compared to the 15 to 17-year-olds. And as you go up in age, your risk of hospitalization and death increases. And in some groups, it's really dramatic. So 40 to 49-year-olds, this is a young age group. They have 15 times the risk of hospitalization and 130 times the risk of death as someone who is 15 to 17-year-old. And when you look at those who are 50 to 64 years of age, you'll see the risk of hospitalization is 25 times higher, and their risk of death is 400 times those who are 15 to 17-year-old. And it just goes up with each age band. Next slide, please. So what can you do? Stopping the pandemic is really going to take all the tools we have in our toolkit. First, of course, continuing to protect yourself until it's your turn to be vaccinated. And this includes all the things that we've been practicing, wearing masks over your nose and mouth, staying at least 6 feet away from other people who don't live with you, avoiding crowds or poorly ventilated spaces, and then washing your hands often. And then when it's your turn, choose to be vaccinated so that your immune system can be ready to fight the virus if you're exposed. Next slide, please. So this slide was created on March 30th, but I find it truly amazing to share that there have been over 47 million vaccine doses administered. And actually, it was well over 150 million doses before I gave this presentation. It's really a truly remarkable feat. So let's turn to discuss what you need to know about these COVID-19 vaccines. Next slide, please. So 3 vaccines so far have received emergency use authorization, that's called an EUA, from the FDA. There are 2 that are mRNA vaccines, and these are the ones that carry the instructions telling your body what the virus looks like, so our body can then learn how to recognize it and destroy it. One of the mRNA vaccines is produced by Pfizer or BioNTech, and another is produced by Moderna. Both of these mRNA vaccines, they both require 2 doses several weeks apart. And then we have a third vaccine that's called a vector vaccine, and it's produced by Johnson & Johnson or Janssen. And this vaccine only requires 1 dose. The viral vector vaccine, it has a shell of a modified virus that has the instructions of how to make a protein, again, that looks like the virus. So similar to our mRNA vaccines, it helps our bodies build these fighter cells, these T lymphocytes and B lymphocytes that will then remember how to fight the virus in the future when we're exposed. The Pfizer vaccine is authorized for people 16 years and older, and while the Moderna and Johnson & Johnson vaccines are authorized for those 18 years and older. I do want to mention that just recently, Pfizer just applied for the use of the Pfizer vaccine in kids 12 to 15, so that may be coming soon. These 3 vaccines were tested in a diverse adult population, including minorities and older adults, and all of the available vaccines have proven to be effective at preventing severe illness, hospitalization, and death from COVID-19. But it's important to know that we really still don't know how long the protection lasts after you receive your COVID-19 vaccine. And as you can imagine, this is an area of intense focus that we're continuing to provide updates on as we learn more. Next slide, please. So COVID-19 vaccines are being held to the same safety standards as other routine vaccines. There are several expert and independent groups that evaluate the safety of vaccines being given to people in the United States. And before any vaccines receive authorization or approval, the Federal Drug Administration, or the FDA, carefully reviews all the safety data from the clinical trials. And then there's another group called the Advisory Committee on Immunization Practices, or the ACIP, which is an independent body of experts that also, again, reviews all of the safety data before making recommendations. After any vaccines are authorized and in use, both the FDA and the CDC continue to monitor safety. We have existing systems that can rapidly detect any possible vaccine safety problems, but as you can imagine, these systems were also scaled up dramatically for the COVID-19 vaccine introduction to meet the needs of the nation. I'd like to mention a couple of these systems just for you to get familiar with them that allow CDC and FDA to watch for safety issues. One that is particularly important to me is called Be Safe. It is a new smartphone-based app, and after you receive your vaccination, it will provide a health checker for people to make sure that you're monitoring for side effects and reporting them. And then the CDC and FDA together have a system called VAERS. That's the Vaccine Adverse Event Reporting System. This is a national system that collects and reports information from health professionals, manufacturers of vaccines, and the public, and it tracks adverse events that happen after vaccination. VAERS also collects reports of adverse events that are unexpected or anything that happens more often than expected, and it looks for patterns in these events, and then, of course, follows up on those patterns with specific studies. Next slide, please. So as we've discussed today, millions of people in the United States have received COVID-19 vaccines under the most intensive safety monitoring in US history. And all of these COVID-19 vaccines that are in use and the ones that are in development are being evaluated carefully in clinical trials. And then, only then, are they authorized and approved if the benefits outweigh the risks. But, you know, as you're thinking about being vaccinated, I want you to think about the fact that it's not only important to protect your health, but it's also important to protect those around you, especially those at an increased risk for severe disease. Next slide, please. So some people have asked, why get the vaccine and not just get immunity through getting the virus itself? Getting the COVID-19 vaccine is a safer way to help build protection. When you get the virus that causes COVID-19, it may offer some natural protection known as immunity, but we don't know how long this protection lasts, and the risk of severe illness and death from COVID-19 far outweighs any benefit of natural immunity. Getting the vaccine is just a safer way to build protection. Next slide, please. So what should you expect when you receive your COVID-19 vaccine? Let's start with the logistics. When you receive your vaccination, you'll get a vaccination card that tells you which vaccine you received, the date, and where you received it. You'll also get a fact sheet that tells you about the vaccine a little, and you'll be monitored for 15 to 30 minutes to make sure that you don't have any severe allergic reaction after vaccination. This is extremely rare, but it's important to be careful. You should also receive information about enrolling in Be Safe, and Be Safe is really important to me, so let's talk a little bit about that. Next slide, please. I really encourage you to sign up the day you get vaccinated for Be Safe. This is a free smartphone-based tool that uses text messages and web surveys to provide a personalized health check-in after you receive your vaccine. Enrolling in Be Safe not only ensures that we're able to learn about your side effects and when they occur, but it'll also text you to help you remember to make your second dose appointment if you need one. It's especially important for those who have high-risk medical conditions to enroll in Be Safe so that we can watch you really closely and make sure that there are no side effects or concerns. Next slide, please. I am happy to say that the results of our monitoring is reassuring. And while some people have no side effects, many people do report mild side effects after COVID-19 vaccination, like pain or swelling at the injection site, a headache or chills or fever. You may feel particularly tired or have muscle pain or even some fever or nausea. This is all totally normal, and it's just your body working really hard to build protection to help fight the virus. To reduce the pain, you can apply a clean, wet, cool washcloth, move or exercise your arm, and of course, make sure to drink plenty of fluids. You can also reach out to your healthcare team if the redness gets worse after 24 hours or your side effects are worrisome or don't seem to be going away. At this point, we don't recommend that you take over-the-counter medicines like ibuprofen or aspirin or acetaminophen. Those are Tylenol and Advil and ibuprofen before you get vaccinated to try to prevent the side effects. If you need them because you're uncomfortable, then that's okay. But we really we want to make sure that your body responds very well to the vaccine and prepares your immune system as fully as possible to protect you from the virus. Next slide, please. And as I mentioned, of course, call your doctor if the redness or tenderness gets worse after 24 hours, or your side effects are worrisome or don't seem to be going away after a few days. And as always, if you get the COVID-19 vaccine and you think you may be having a severe allergic reaction, even after you've left the vaccination site, you should call 911. Next slide, please. So after you're fully vaccinated. So fully vaccinated means that you have received both doses of a 2-dose vaccine series or 1 dose of the Johnson & Johnson, and that it's been 2 weeks since your final vaccination. So if you're fully vaccinated, the CDC just released guidance that you can visit with other fully vaccinated people indoors without wearing masks or physically distancing. And it's pretty exciting to me. You can also visit with unvaccinated people inside and unmasked, but from one other household. And this is as long as they don't live with someone who's at increased risk of severe disease. And finally, if you are exposed to someone, if you're fully vaccinated 2 weeks after your last vaccination, and you're exposed to someone with COVID-19, you don't have any symptoms at all, or you don't live in a group setting, it's okay for you not to get tested or to go into quarantine. Next slide, please. But keep in mind that while in a public setting or with others who are unvaccinated from more than one household, and visiting with unvaccinated people who are at increased risk of severe illness or death, you should always take the steps that we're aware of to protect yourself, like wearing a well-fitted mask and physically distancing. We're currently still recommending that you avoid medium and large in-person gatherings, that you follow CDC and your health department's travel recommendations, and since no vaccine is perfect, that if you're experiencing symptoms, you get tested. It's also important, of course, that you follow the guidance of your workplace. Next slide, please. So I wanted to address some key facts about COVID-19 vaccination and some of the common myths that are circulating. I think at this point, we can all agree that getting vaccinated can help prevent you from getting sick with COVID-19. People who have gotten sick with COVID-19 may still benefit from getting vaccinated. Unfortunately, we've seen that reinfection with COVID-19 is possible, so the vaccine should be offered to everyone regardless of whether they've had COVID-19 infection before. And at this time, the experts don't know how long someone's protected from having COVID-19 after they've recovered, so it's important to think about that. COVID-19 vaccines cannot give you COVID-19. None of the authorized vaccinations or the recommended ones currently have any live virus inside that causes COVID-19. And that means that a COVID-19 vaccine cannot make you sick with COVID-19. COVID-19 vaccines will not cause you to test positive on a viral test. Now, it's important that you hear viral test. Neither the recently authorized nor the recommended vaccines, nor any of the vaccines that have been in clinical trials in the United States will cause you to test positive on a viral test. This is used to see if you have a current infection. Having said that, your body develops an immune response when you get a vaccination. Those are antibodies. So you could test positive on an antibody test. An antibody test indicates if you've had a previous infection or if you've been immunized. So we're currently looking at how the COVID-19 vaccination may affect antibody testing results. Next slide, please. So hopefully you've learned today that COVID-19 vaccine can protect you, your family, your friends, and your community. I personally hope that you've all learned to choose to get vaccinated and to choose to participate and be safe, and to help CDC monitor for side effects after vaccination. I believe personally that we all have a role to play to protect ourselves and our communities, and it's important that we consider being a trusted messenger. After you're vaccinated, consider sharing your experiences with your coworkers or your friends or your family. Listen to their concerns. Listen unbiased and listen with open ears and talk to them about what you've learned. If you need help answering questions, I wanted to show you our website. Next slide, please. So this is the CDC website, and if you look at the top, you'll see this is the vaccination section of the page. And note, it has information about all the basics right here in the center. And then there's this next box, this nice box on the right, that helps you connect with your health departments to know when it's time for your vaccination. Next slide, please. We have loads of information on the CDC web page. There's slides, frequently asked questions. Next slide, please. And then there's customizable information. If you're supporting a community-based organization or a church, you can insert your information about your organization and utilize our templates. There's also a photonovella for lower reading levels, and we've got information and resources that you can also use on social media. Next slide, please. There are also vaccination communication toolkits and materials in many, many different languages. So please, please feel free to come look. Next slide, please. So what is important is that you learn yourself about COVID-19 vaccination, that you ask questions, that you talk to your community members about whether you decide to get vaccinated and what your experience has been. Because it's from these personal interactions with the people that we care about and those that we relate to the most that are going to make the biggest difference. Next slide, please. Thank you for having me.
Dr. Coleman King, thank you so much. This was so much information, and you really condensed it and made it easy for us to understand and process and sort through all the details. And I really appreciate your being here today.
Thank you for having me.
Yes, and do you have time for us to answer a few questions from the community?
Of course, absolutely.
Okay, great. So the first question that I have, when is it safe to visit my family? In particular, I have school-aged grandchildren.
Yeah, we're all feeling the pinch from this. I think we all have people in our lives that we've missed a lot and are ready to hug and to be close to. So after you've been fully vaccinated, and remember when I talk about fully vaccinated, that means for a 2-dose vaccine, you've had your first dose and your second dose, and then 2 weeks have passed since your second dose. And for a 1-dose vaccine like Johnson & Johnson, you've been vaccinated and then you've had that 2-week entry point so that you've built up all of your fighter cells. And after this, you can go indoors with fully vaccinated people without wearing a mask. And you can also gather indoors with unvaccinated people from one household. And so that would be these grandchildren and family members that you're dying to see. And you know, it's important to note though that if you don't have on a mask, you need to ensure that none of the unvaccinated people are at high risk for severe disease, or they don't live with anyone who is at high risk for severe disease. And keep in mind, that includes a pretty good list of people. You saw that there are the medical conditions that increase your risk of severe disease, that COPD is one of. So you have to make sure that they don't live with anyone who's on that list who hasn't been vaccinated. But also remember that this includes those who are over 65 years of age. So if they live with someone that is over 65 years of age who has not been vaccinated, that would be someone at higher risk. And then, of course, due to the longstanding systematic health and social inequalities that I mentioned before, this can also include some racial and ethnic minority groups. So it is a little bit trickier than just to move forward.
Thank you.
I hope that answers your question.
I think it really does. I think especially, you know, making sure that clarification is there, you know, visiting with other people from one household, you know, I think that really makes it clear. And so I appreciate that clarification again. I do have another question here. This person says, I got my first dose of the vaccine and had side effects, and I'm worried that the second dose will be worse. And following up to that, could those reactions cause my COPD to flare up into an exacerbation?
Yeah. So it's hard to say whether the side effects of someone's second dose will be worse. There have been reports, some folks do have worse side effects with their second dose, but I can share that I was really dreading my second dose. And I have to say the side effects from my first dose were worse than my second dose. So, but either way, there's nothing that compares to the relief that I felt after being vaccinated. And I hope that this member chooses to go ahead and get their second dose. As far as, and you know, I also should add that we do know that the side effects of getting COVID-19 are much worse. Even though you do get some protection from your first vaccination, and it is substantial, it is really important to go ahead and get that second dose. When we think about a COPD exacerbation or flare, you know, I really had to think about this one. And, you know, anytime you're receiving a vaccination or, you know, doing some sort of medical procedure that could be causing you to feel kind of under the weather afterwards, it's always important to plan ahead. You know, planning ahead is the best medicine. So making sure that you have the support that you need to ensure that you're able to get up and move around, even if you're feeling a little under the weather, and then making sure that you stay hydrated, get good nutrition, and that you consider using your incentive barometer or taking deep breaths throughout the day just to make sure that you're opening up those airways. That's probably the best. Yeah.
Yeah, I think that is 100%. You know, be prepared, have a plan, and we promote that kind of behavior anyway, right? So be prepared, plan ahead, have a plan in place, a support system. I think that's great advice. Yes.
Great.
I do have another question here from the community. This one says, I am looking forward to getting my first dose in the next week or so. If I normally take Tylenol every day for my arthritis, should I hold off on taking it the morning of my shot?
Yeah, so at this point, we really don't recommend pre-treating with Tylenol if you're worried about preventing side effects. So if you're able to not take your Tylenol in the morning for your arthritis and you feel comfortable with that as being an alternative, it's probably worth just trying. And then if you feel bad or if you're feeling particularly achy, then you can take it after your vaccination. Having said that, if you're in a lot of pain and don't feel comfortable avoiding Tylenol, I think that's a perfectly reasonable decision to make. You know, this is all really what we're learning from other vaccines. So when we think about utilizing what we call a non-steroidal or anti-inflammatory medicine like Tylenol or Advil, all of those can dampen down our inflammatory response. And when we get a vaccination like this COVID-19 vaccination, we want that immune response to really come kicking, especially in anyone who could be immunocompromised or maybe a little bit older and not typically have as strong a response. So that's why I'm saying if it's possible, then perhaps don't take your Tylenol the morning of the vaccination. If you don't feel comfortable with it, then that's a reasonable alternative.
Thank you. I have two more questions here that have come in.
Okay.
This person says, in the news, we are seeing that Europe is dealing with another wave of infections. Is this something that we should expect here too? Or are we vaccinating at a faster rate or have more access to vaccines? I would just love to hear your thoughts on that.
Yeah. Gosh, don't I wish I had a crystal ball.
Right.
It's really hard to say whether our case numbers will have a similar pattern, but I can tell you that right now we are seeing an increase in case numbers and an increase in hospitalizations. And just in the last week, our CDC director has been doing some media work to try to help the nation know that we are concerned with where the case rates are going right now. We're seeing some incredible spikes in some areas, including the state of Michigan. So with this in mind, it's particularly important for us to have conversations like this about vaccination, protecting as many people as we can who are currently eligible for vaccination. And then if you're not yet eligible, using all those tools that we've really been honing over the last year, wearing a well-fitted mask, social distancing of at least 6 feet, washing hands, staying away from poorly ventilated spaces, and really being careful.
Right. I think I'm hearing you say this pretty loud and clear. So if you're waiting on a specific vaccine, don't. Whichever one you can get to first, that's the one you should get. It's the vaccine is important. It doesn't matter which one it is, right?
Absolutely. Yes, you should. And I tell all of my friends and my family this, take the one that is available to you. I had one type of vaccine. My husband had a different type of vaccine. My father had a different one just by chance, but we took the ones that were available to us, and I would recommend the same to you.
Great. Thank you. Last question. This is a long one. So
okay.
I'll get to it. If I am fully vaccinated, I realize I can still get the illness, but it just won't be as severe. However, my question is, if I get COVID, is it possible that I might still have some of the after effects of the illness? For instance, the blood clots, fatigue, blood pressure problems, and more symptoms that are associated with long-haul COVID, even if my illness wasn't severe, or maybe I didn't even have symptoms. So I know that was a long question, but I think they're just asking about, is it possible to still have long-haul COVID even after being vaccinated?
That's a really good question. You know, we are still learning about long haul COVID and we're still learning when exactly it occurs. And fortunately, very fortunately, these vaccines have been so enormously protective that I won't say that we have not had anyone get COVID who has been vaccinated, because that's not true. We have had some what we call breakthrough cases. But those have been very few. And so at this point in time, I don't think we have any evidence to suggest that, that people who are getting these breakthrough cases of COVID-19 after vaccination are necessarily at risk for long haul COVID. Having said that, we are still creating the definition for long haul COVID and exactly what that means and exactly what you might do about it. I really would suspect, you know, we've seen some recent really kind of more anecdotal reports, but very interesting reports that people who have had long haul COVID actually have a reduction in their symptoms after they're vaccinated. We don't know whether this is all true yet, and like I said, we're still trying to better understand long haul COVID, but it certainly, in my mind, would point towards maybe there not being a link, so as big a risk, I guess I should say.
Great. Well, thank you so much. Again, I thank you for being here, for spending your time with us today, and for sharing your experiences and your expertise with us. This community, I know they appreciate it as much as I do. And so thank you.
Yes, it is such a pleasure to be with you, and I hope that that each of you will continue to learn about COVID-19 and COVID-19 vaccination as you determine whether you're going to get vaccinated or not. But I hope you choose to.
Thank you. And for those of you who joined us today, thank you for being here with us. If you have more questions or need more information, you can visit the cdc.gov website, or you can visit the COPD Foundation website at copdfoundation.org. So thank you so much and have a great rest of your day.